Well, another shortage at healthcare facilities now. A drug used to treat common infections could soon be in short supply in this state. Capitol correspondent Jamie DeLine tells us more.
According to the FDA, there's a shortage of the antibiotic amoxicillin, which is used to treat bacterial infections such as ear infections or sometimes sinus infections.
Why is it happening? Who knows? Maybe the surge of hospitalization and illness has kind of caused the use of amoxicillin a little more frequently. Um, Kids' immune systems have been dormant for the past couple of years because they haven't been exposed, because we've been isolated.
Dr. Jim Saperstone says it's the liquid form that's in short supply, but Albany pharmacist Zarina Jalal says at her pharmacy, the inventory is fine right now.
I looked at our wholesaler's website and there are allocations on the item, which generally indicates that the product is in short supply.
I also reached out to Walgreens about their supply and was told, quote, although demand for amoxicillin has increased, Walgreens is still able to meet patient needs at this time and will continue to work with our suppliers and distributors throughout the season to best serve our patients. CVS echoing a similar message stating, quote, there is an industry-wide supplier shortage of certain doses of amoxicillin and we are working with manufacturers to replenish the supply as quickly as possible. The New York State Department of Health telling me while the department is not aware of any shortages impacting New York at this time, it will continue to monitor the situation and work closely with providers. According to Jalal, the amoxicillin shortage isn't something to be very concerned about and that drug shortages do happen from time to time.
Providers do have options in terms of other antibiotics to use, but what specific one really will depend on the type of infection a person has.
Jalal reminding everyone that an antibiotic doesn't have to be the first option.
A lot of times a person's infection, even if it is bacterial, will resolve without an antibiotic. So be prepared for that. If you are bringing your child to the doctor's office or to urgent care, you may not always get an antibiotic, and that's okay.
Reporting in Albany, I'm Jamie DeLine.